And then our big, most significant reform in the United States in the 20th century, before we get to the 2010 comprehensive reform, is Medicare in 1965. And what is so significant about that as far as the insurance company model goes and the way our system is set up is by the time we get to that point, you still have a lot of the same reformers who were around maybe for the Truman battle and, still like the Social Security Administration, a lot of labor leaders and people who were interested in health and welfare issues who had been trying to get us back to, say, the prepaid physician model, some of those more progressive models, or more interested in nonprofit models. But by the time we get to the 60s, because the Medicare debates are really heating up by the end of the 50s and the early 60s, they're saying, as much as we wanted to get rid of this insurance company model, we're just not going to be able to do it. I mean, all the institutions are set up this way. Hospitals are set up this way. Doctors are set. All of the overlapping institutions that that these medical providers have forged with the financiers, the insurance companies, the processes, the utilization review committees, the way they do the billing, everything has been the tables. Everything's been set up, and not only that, this is what our voters and our citizens are used to. And if we try to have a healthcare program for the seniors that's different, that looks different, it's not going to be as popular. Right? Medicare is a very, very popular welfare program. It passes with bipartisan support. Even people who didn't vote for it, almost everybody supported an alternative, just another kind of Medicare program, right? So it was very popular. But what's so important is that they're saying, yeah, we're just going to build it right on top of the insurance company model. And that's what they just plunk it down on top of that. And you know what? We're just going to have insurance companies manage the program. So insurance companies become the go between the federal government and the hospitals and the doctors. And that way they can use all the processes and the institutional pathways that they have already set up. They can go ahead and use that. And plus the beneficiaries, the elderly, those over 65, they'll be able to interact with their physician and hospitals like they always had, right? It'll look normal to them. But that's just very important because then it just kind of naturalizes the insurance company model. It makes everybody think that it's just this thing that naturally arose out of the market. And this, because the AMA all throughout the 40s and 50s is arguing that this is the so-called private market or voluntary market, and this is the American way, the answer to socialized medicine. But that's not true. But everybody just kind of buys into it. They forget, right? Memories are short. So with Medicare, you have this naturalization of this very strange economic model, and it just gets forgotten. And then everything after that is just an attempt to bandage. And you can see, it's almost kind of hilarious to see the way they're trying to band-aid it up. In the 70s, they have some reforms that are kind of trying to recapture the prepaid physician groups, but you almost have to laugh because they're trying to do it with the insurance company model. And it's a very clumsy way of doing things. They don't quite get that. No, you still don't have the doctors have to be incentivized, that they're tied to the bottom line. It doesn't work if you just have a prepaid physician group, but they're all on salary. That's what Kaiser Permanente, that's a prepaid, that's we still have that, but that's not the same thing, because physicians on salary, that's a prepaid group run by a corporation, not run by, physicians don't run it and manage it, and they're not tied to the bottom line. If anything, they just get salaries, and they actually get bonuses based on how much care they'll withhold.